I'm Jim.
I'm Karen.
And we do slow travel across the globe.
We want to give a huge thank you to the entire team at ALTY Hospital for making this video possible. This hospital has transformed my life. My hip surgery, my hip replacement has given me and I think us a new lease on life, and we hope we can do for the same for someone you love.
Please share this video with someone and give it a thumbs up. Let's spread the word. This hospital does wonders for people. Someone you love may be helped by this information. Watch the video all the way through. It's interesting and it is really worth watching. Now we have with us Dr. Lee, who's a cardiologist, and she knows about the health screenings here. And what we wanted to do is just explain what's offered in health screenings here in ALTY.
Okay, hi, I'm Li Ching here. So we do health screening in these hospitals. So basically, we have different packages. So let's talk about the general packages first. So general packages were three packages. Depends on your age, right? And depends on your requirement, and depends on your clinical status as well. So we'll offer you a different range of screening. So it varies from blood tests, imaging like X-rays, ultrasounds, like the mammogram as well. And for heart-wise, we also do the ECG, stress test, even a CT coronary angiogram to make sure there's no blockage of the arteries, right? Okay, because this is the orthopedic hospitals, so we do bone screening as well. So be like joint screening or osteoporosis screening. So it depends on what you need.
And the screenings that you offer are not only for orthopedic though.
Yeah.
So you can do anything that some of the other very famous hospitals do here.
True.
And offer the same type of screening.
Same types of screening. Like it's just like the general screening. Like we have different packages, depends on your age and your clinical status as well. Let's say you have more medical problems, then probably we offer you, or a family history, probably we offer you more extensive one. Yeah.
And you'll be able to help guide a patient as to what's the proper screening for them.
Yeah. So usually, we can talk to the patient first and find out what they need and what's the family histories like, the clinical situations, and then we offer accordingly.
Thank you, Dr. Lee.
Did I talk too much then?
Okay, can you introduce yourself and tell us a little bit about the hospital?
Hi, my name is Badru. I'm here as Director of Allied Health and Operation at ALTY Orthopaedic Hospital.
Tell us a little bit about the hospital.
ALTY has been officially launched in July 2022, and we are a single specialty hospital on a focus on orthopedic, spine and joint, and we are also offering health screening services at ALTY Orthopaedic Hospital.
Can you tell our viewers what sets you apart from some hospitals everybody knows the name of, without saying the name of those hospitals? I just want to know why they should come to you if they want a hip replacement, a knee replacement, or spine surgery.
As you know, ALTY stands for Adding Life to Years, and here in ALTY, all of our orthopedic surgeons is very experienced surgeons. And in terms of technology, we are among the first hospital in Malaysia that having the latest technology. For example, the EOS imaging and also weight-bearing MRI. And our doctor here is very experienced doctors and doing the operation or surgery that other people not doing.
And just a question on the knee replacement surgery, which a lot of people think that knee replacement surgeries are really difficult and you end up in bed for a long period of time. How long before a person can actually stand up?
Even here in ALTY, we're having the robotic knee surgery for the TKR or total knee replacement. Even patient can walk even after 1 day of the operations.
Thank you so much.
Welcome.
This is Carrie. This is the girl who contacted my wife when we originally came and decided we were going to have Karen's surgery done. Carrie is a joint navigator. Carrie can explain, what do you do as a joint navigator?
Okay, so yes, as a joint navigator, I would usually do my pre-op counselings with my patient by asking them questions on what to prepare before their surgery and also to provide them educations as well. And right after surgery, I will also let them know on how to take care of themselves after their hip replacement surgeries and what should and should not do after hip replacement surgery.
And how long do you continue to do follow-up with the patient after the surgery is done?
Usually I will follow up with them up until 1 year later, but usually after the surgery, after 3 days later, about 6 weeks later, 6 months and 1 year later.
And what can you tell viewers here that are thinking of doing surgery about the recovery?
Okay, so here in ALTY, we practice ERAS, which is Enhanced Recovery After Surgery. So what we will usually do is we'll encourage patients to start walking 6 hours later after their surgery to promote earlier recovery and also to actually encourage them to follow up with their physiotherapy as well to ensure that recovery is a smooth sailing one.
Okay, this is Amira. She's the assistant manager for radiology. Amira, can you tell our viewers what advanced equipment you have here in ALTY?
Alright, sure. So first of all, we do have this new open MRI weight bearing. Okay, usually you might seen it somewhere, but it's only open MRI. But this is special because this is a weight bearing MRI, meaning that apart from the patient doing the MRI lying down, we can do the patient, the MRI of the patient in upright position. Meaning we put some weight on the patient, normal weight bearing for the patient, so the doctor can see if there's any difference with the images, if the patient done the MRI in lying down and also standing up. Sometimes there is, because sometimes when patient comes in, they say, I'm having trouble, I'm having pain whenever I'm walking. When they do the MRI lying down, the MRI is normal. Alright, so the doctor might want to see, okay, if let's say we put some weight on the patient, if there is any difference in the MRI. So this is the machine that does it. Okay, so I'll show you once how we turn the machine into an upright position. Alright, so now the machine will turn into a 90-degree position. Yes.
Amira, how many of these are in Malaysia?
This is the only one open MRI weight bearing in Malaysia. The one and only.
This is brand new technology then?
I'm not going to say it's a brand new, but this is in terms of the new things is the machine is in the upright position. Open MRI has been here for a while already. It's just that this one, it's with weight bearing.
So you can actually stand in it?
Yes. So the patient, we don't do the scan for a long time. Probably we do about 15 to 20 minutes of the scan while patient is standing up, so they don't have to stand up for quite a long time.
And I would think for a patient that has claustrophobic,
this is better for them.
it would probably
Yes,
be
correct.
easier for them. Does it make a lot of
Correct.
noise or no?
Because this is a 0.25 Tesla compared to the closed tunnel. The closed tunnel is 1.5 Tesla. It's a bigger magnetic strength. This is 0.25 Tesla, so the noise is slightly reduced. Yeah. So we have another new machine, a new fun machine, not scary machine. This is a new fun machine. Alright, so this is an X-ray machine. This is called EOS. Alright. So what EOS does is we can take the images, the X-ray images of the whole spine, whole body, and also whole lower limb. Alright. So the doctor can measure if, let's say, patient has scoliosis. The doctor can see the spine clearer. Alright, and also the doctor can measure if there's if the doctor wants to see the corpse angle, if there's any misalignment, and also the length of the spine, also length of the lower limb. Alright, so this is the one and only in Malaysia. Alright, and then the EOS, it gives out radiation about 50 to 80% less radiation compared to the conventional X-ray. Yeah, and also it can give out a 3D CT scan-like image as well. So the patient will come in here and then just come out here and then stand like this. Okay, and then the X-ray will be taken. All right. So the X-ray will be taken from the front and also from the side simultaneously. All right. So this is the sample of images that we can get from the EOS itself. As you can see, this is the 2D images. You can see the spine. This is for the whole spine, so you can see the spine, and this is the post-op images, so you can see the artifact, the implants here. All right. And also this is to see if there's any misalignment of the spine. Okay, this is from the side, this is from the front, this is from the side, and also a few measurements that we can get also, like this one, PI or pelvic incidence and pelvic obliquity. This is sort of the measurement that the surgeons will require to perform any surgery for the patient before they do the surgery itself. So you can see this is the report that we can get from the EOS.
So this would be used for spinal surgery
For
too
spinal
then?
surgery, yes. So this is the sample images for the lower limb. As you can see, if the doctor requires to see the length of the lower limb, so we can measure it. This is that sort of images that we can get. So this is almost like a CT scan image, 3D CT scan image of the lower limb. As you can see, similar to a CT scan image. So then the patient doesn't have to go through CT scan to get this sort of images. So it's less radiation for them. They don't need to do multiple imagings. Just one EOS and you can get everything. Alright. So they can get measurement as well. Usually for the lower limb, it's either the doctor wants to see the length of the lower limb, or if let's say patient has done any surgery, for example, hip replacement, and if they want to see any discrepancy after the surgery, we can do it here as well.
Hi.
Hi.
We're here with my doctor, Dr. Badru. Like you to tell us who you are and how and what's your specialties.
My name is Badru right? As you know, I've been practicing orthopedics for the past almost 30 years, right? And doing hip and knee replacement in more than 20 years. So I joined this hospital, orthopedic hospital, like 5 years ago. When it started, a few of us are the pioneers here. I was practiced somewhere else, but when they want to open a hospital which is only specialized in orthopedics, and they equip this hospital with all the orthopedic centric equipments, and that's why I joined these hospitals. And I've been here since past 5 years and doing what I like. Yes.
Fantastic. I couldn't have been more pleased. I came to you, as you know, hoping for maybe some alternative ways, but as you explained to me, my situation was that it really was at time that I needed a hip replacement. So why did I need it? What does that entail?
Yes. Karen, you are not the only patients who come to see me or see us here for second opinion, right? And many of them are actually try to avoid surgery, right? So if I explain in appropriate way that you understand the need to do the surgery. Of course, I do stem cell as well. Of course, the first thing that you come to see me, do you do stem cells, right? So, yeah, stem cell is good. It must have its own indication. Many a times, patients will do that anyway, and they did not get good results, and they will waste a lot of money because stem cells is very expensive. Hip replacement surgery is, of course, what you did is this definitive treatment for a stage 4 osteoarthritis. So, of course, many will try to avoid hip replacement surgery, not knowing that this surgery now is not to say easy, but technically is better. Implant has improved, and patient like you do well, right? And it takes about 4 to 6 weeks for you to be normal, like the other hip.
Yeah.
So you feel that, right? So
It's better than the other half.
yeah. So again, I would say replacement surgery is what I think one of the magazines says that is one of the invention of the century. It does really change people's life in many ways. But again, I'm talking about this hospital also as an orthopedic hospital, which we are part of, a bigger institution called One Asia Health. So there are a few hospitals like us. One is specialized in heart and one is specialized in surgery, and we are specialized in bone and joints. We also have spine surgeons here. Yeah, we have sports surgeons. I'm doing sports as well, and we have anesthetists who are really good with blocks and regional anesthesia, so that you don't have pain in the first few days of surgery. Did you have that?
No, I had
Yes,
that.
yeah, you had the block, right?
I had the block.
Yeah,
and
so
it was amazing.
yeah, so a lot of patients will think that when they had the surgery, they will have a lot of pain. They can't walk. They suffer the first few days. Those days, yes, good old days, yes. But nowadays, with technology by the anesthetists who can do regional block after the surgery, that do wonders. And in some areas in US, they even do 24-hour surgery because of these blocks, right? I mean, 24 hours day surgery.
Yeah, but that's one of the things I appreciated about here is that I was going to be in the hospital for a day or two afterwards, so you could see if there was any complications. And the other thing I just wanted to thank you. You always checked in the morning and the night, came and saw me, always asked, the questions and how I was doing, and you put me so at ease. You're absolutely right. You put it in a way and gave me the confidence to do this, and I can't thank you enough.
You are a good patient anyway.
Not if you ask my husband.
She's a pretty good wife, though, too.
Yeah, Jimmy was always there.
We appreciate everything you've done. Yes. Thank you so much.
Yes. All right. Good.
Hi, I'm here with Renee, and she was my physical therapist after my total hip replacement. Absolutely amazing, saved my life, and I really attribute all of my progress to you.
Thank you.
So tell me about you. How did you come to physical therapy?
Well, I started as an athlete, so I was a national athlete before the physical therapy. So I kind of understand why it was important to do physiotherapy, and I got to love doing it. So I was like, I want to do this. I want to make a career of this. I want to help other people as well.
How long have you been doing it?
I've been doing physical therapy for 6 years.
6 years?
Yeah, 6 years.
So what entails physical therapy, and how do you come about what programs, like what did you put me through, and how did you know how I was progressing?
Okay, so normally how we go is that we have a phase. Okay. And depending on the surgery, so you had a hip replacement surgery, so we go by phase. The first few weeks is going to be slow, but that doesn't mean that we do it like, oh, it's just a simple up and down. No, we need to focus on the muscles that are currently weak. And it's also that important to build the muscles so that we may attribute to you starting to walk, do some long walking, a little bit of bending and all that. But in a sense that we don't push it. We go according to your level, and then we start from there.
That's what I noticed.
Yeah.
You always took me to the end of the cliff. You never threw me off, but it was just enough to keep me motivated and kept me moving. One of the things I really like too is the Rebi program that you sent. Can you tell me a little bit about that?
Okay, so the Rebi device is a new device for us as well, but it has been helpful like a lot. So like for patients who've done TKR, THR, it's easy for us to help monitor them. So in a sense, like in case they can't come for physio, we can at least monitor them at home. We've set programs, we've set how many repetitions, how many sets. There's even like, we ask them like an end question, are you feeling all right? We do follow up with WhatsApp. It's like, are you okay? How's your exercise? And then we'll give you a call and all that.
And it does, it has at the end of each one, it asks me if it was easy, hard, what kind of difficulty level, and what my pain level was.
Yes.
Which was amazing.
Yes, that's how we monitor as well, because we don't want patients to overdo it and then we not know. So we will always monitor, okay, you've done your exercise today, let's see your pain level. Your pain level's good, she's doing fine.
And who was your favorite patient of all time?
Of course it was you. My favorite, best one.
That was what I wanted. Thanks for everything.
You're welcome.
If you've made it this far in the video, we want to thank you for watching.
Thank you.
One word I do want to say is that the health screening at ALTY was just as good as any other hospital that was offered here in Kuala Lumpur. Prices are reasonable. It was very, very comprehensive. Even if you don't need orthopedic surgery, trust me when I tell you the health screening is very, very comprehensive. Now that we get that out of the way, I want to turn it over to Karen and let her tell you, since the operation, what's going on.
Well, I'm about just over 6 weeks now, and I have pretty much full mobility. I've been walking about 6,000 to 8,000 steps a day, off and on. Still doing my PT at home now, and we're traveling on. We're going to be leaving Kuala Lumpur now. I can't tell you how much of a difference this has made. Where we used to try to go to the mall or go to walk or go see something, and I always had to keep in mind, how many miles do I have in this hip? Like how many steps can I walk before I just basically just in too much pain to walk anymore. So it was really more and more limiting the things we could do.
And one of the things that I noticed too, we'd have to stop. A lot of times you had to find a chair. Had a chair to sit down, and she was in so much pain, we'd be within a couple of blocks of the house or the apartment or wherever we are, and I'd want to call a Uber or a taxi or something to get us home because she was in such pain. No pain. None. So again, like we said before, share the video with a friend. They may have someone they love that needs help. This video will possibly help them. The hospital is fantastic.
I'm so surprised by their facilities. And just a quick side note, when we say that this here was amazing, just as amazing as what the healthcare we could have found in America, just not as, I don't know what, expeditious, just not as, what?
It was quick. From the time we said yes until the operation took place, and she stayed in the hospital. When she was released, she was able to walk.
Or just the health screening.
Yep. The health screening was the same thing. 3 hours, we were done with everything.
The appointment. We have a video on that. You can see that it was just. Do we have a video? Someone has a video.
I don't think we have a video, but we have Dr. Lee talking about it on this video, which, if you're watching to the end, you've seen it. In any case, we want to thank you for watching. Share the video. Give it a thumbs up. Let's get the word out there, because there's somebody around that may need it. That's it.
Thanks for watching.
Say goodbye.
Goodbye.
Bye.